Hey, it's Brad Perry with Kingwind Physical Therapy. Sometimes we have to use dry needles, which are basically acupuncture style needles that we go into the muscle to try to get some type of twitching or get it to relax if it's tight. Sometimes we go in there to use a proliferation type of technique where we're trying to increase blood flow to the area. So we use it for different reasons. Today we're going to approach a shoulder that's a little stiff and tight on the backside with some dry needles. And sometimes with our dry needles, we'll incorporate like a TENS unit of basically electrical stimulation to help that muscle relax a little bit more, or sometimes to activate it, just depending on what we're looking for. So we're going to go into that right now. Okay, I'm going to come in here and I'm going to try to get to her rotator cuff muscles. There's two primarily in the back that get stiff and tight sometimes, but they are underneath some other layers of muscles, so we're going to go a little bit deeper to get to those muscles. Okay, so we've got the deltoids coming through here, some of the traps are coming through, and then I know that I'm on the rotator cuff because I can feel this bone here. Okay, it's the spine of the scapula, and I'm going to drop down and then drop a needle right into that posterior rotator cuff muscle. Okay, so I'm just going to go down. Good. I'm going to drop a couple into that muscle. This is called the infraspinatus, is what I'm trying to target. And now I'm going to go down into teres minor here. It's just another little rotator cuff muscle that gets a little tight. And hers is pretty tight. I can kind of feel it as I go in with the needle. I can feel some of the resistance of that muscle when I go deep in there. All right, and so with this, what we can also do is get an electrical stimulation involved. So we got what we call our little alligator clips that we'll put on the needles because they are going to be conducting the electricity. All right, so here's the electrical stimulation. Sometimes you'll see the muscles start to twitch whenever I increase. Oh, you saw that? This right there, you can kind of see them kind of twitching just enough. And that little bit of a twitch can sometimes just get those muscles to relax. So sometimes we'll get them to hang out here for 5-10 minutes. Just kind of depends on how tight and how painful it is. But usually after this, they're feeling really good and can move their shoulder a little bit better.